Hey guys, what's up? It's Amrit. Today I'm going to be talking about the Samantha Definition Flash by Siemens. Very, very good scanner. That's what it looks like. Looking good, looking good. Obviously that's where the patient sits or lays down. So I work in a hospital, obviously, and we have this scanner in our A&E department. Very quick, very precise bit of machinery. Costs quite a few bob. The patient goes right through the gantry right there. One thing I like about this scanner is it's very easy to operate. Software is great to use on this. I mean, I work with GE scanners as well, and believe me, the software on those very difficult to use. I mean, this scanner gets through a hell of a lot of scans day in, day out, 24 hours a day. I mean, it hardly breaks down, and if it does, probably because it gets overused. I don't blame this poor machine. But for those of you who want to know what a CT scanner looks like and haven't seen a CT scanner, here you go. you come in all shapes and different sizes, different companies, but I think the main one out there, or the main companies out there, Siemens, Toshiba, GE, are the main competitors that I know about. Really, Toshiba's got pretty good scanners. Looks a bit like this Siemens scanner, but again, the software is different, and depending on the protocols in your hospital, let's see. I mean, it just depends on the protocols really. But this scanner, for me, I've worked with loads of different scanners. This is the one is for me. I love this scanner. So easy to use, and you know, you can pre-record voices on it, tell people to hold their breath, and you know, while the scans are done, you don't want movement artifacts on it. But you know, let's have a look inside the gantry. So it's basically a big massive circle. We tell people, oh, it's a donut, you'll be going in and out a few times. People get mistaken for an MRI. MRI is pretty good, depends what you're looking for. However, CT is much quicker. That's why we get trauma patients, they can't hear. You get a head scan done in about, what, 2 seconds? Newer scanners, obviously this one's a couple of years old now, but some of the newer scanners, they can do like a head scan in what, I'll say a 1 second maybe. And for those that want to know how a CT scanner works, basically I can't open a scanner right now because I'm at work, I'm doing the early shift, so you know, on standby just in case. And obviously you got the casing around here, and basically inside you've got the x-ray tubes. They spin at quite a hell of a speed, so you're talking about 0.28 seconds RPM just to get the rotation time. So you know, we call rotation time rotation. Obviously it's the time it takes for the tube to rotate once in a circle, but in radiology terms, when you're doing a scan, rotation time depends on what body part you're scanning. So for rotation time for the head will be maybe, I don't know, 0.28 seconds per rotation, or with C-spines it may be a bit, I don't know, faster, slower. It depends on the setup and what you want. So the tubes spin around like this, and then you got your X-ray detector, which is on the complete opposite side of the tube. So when the X-rays pass through you, different energy levels get absorbed and detected by the detector, and these then get reconstructed by the computers using, I don't know, mathematical algorithms, and it's really complicated. And the images, you get them in a black and white picture, and you know, using software enhancements, you can get different colors. You know, you get scans that have different colors, you know, red, blue, pink, showing you what's going on, where the blood is, what's cold, what's warm, all sorts of stuff. And this particular scanner it's a dual source, so obviously it's got 2 x-ray tubes, and you can have quite a bit of fun with it. You know, you can do different stuff. You can extract away the bone and skin, so when you do an angiogram or a scan of someone's blood vessels, you know, we give them the x-ray dye, and this is the pump that gives them the x-ray. So you get a special liquid that you pass into the patient. This connects to the patient where they have their Venflon in the elbow. It will be here. I know my video is a bit, you know, I'm just using my phone to record this. And so yeah, this is the pump. We give them certain amounts depending on what scan they want, and it highlights their blood vessels inside, and you know, on the scan it's bright white, but because this is a dual source, you can extract those images in a particular way. So you know, in the image you can make a 3D image of basically the blood vessels, and it's pretty cool. You can do like a 360. So if you pretend my fingers are like a blood vessel, you can just rotate the image around like this, and you can take away the skin, the bone, all the soft tissues, all the organs. You can cut that out using the software, and then you know, the doctors, they use it to put in stents. You know, they do EVARs, they do I forgot what it was looking for now. There's one we do a scan of the aorta, and they put a stent in, and I've completely forgotten now what the case is that we do here. Not many hospitals do it, and it's a TAVI. That's it. It's a trans aortic valve implant. I remembered, and you know, the scanner scans the whole aorta from top to bottom, and we give them a 3D reconstruction, and they, you know, using measurements, using what the angle is, they put the implants in. So this is what this scanner can do. You know, the scanner can also do cardiac scans, scans your heart, you know, your coronary arteries, and this table, basically the movement, the speed of the table is known as a pitch. Travels quite fast, so it allows you to do cardiac scans in literally a second, and it's a very, very good machine. So this is the Siemens Maximum Definition Flash Dual Source CT scanner. It's in the A&E department. I'm not going to say which one. I don't want you man coming down to where I work. And yeah, hopefully I'll be posting up some more videos. Maybe I'll, you know, see how it goes. I mean, this is first time I'm reviewing something, and yeah, hopefully I can show some images of these cases that we do, and if you're interested, just let me know. But yeah,